Good morning, everyone. My name is Lynette Roach. I'm the External Relations Director for Black Health Matters. I want to welcome you today to our talk on endometrial cancer. Let's talk facts. Did you know that endometrial cancer is the most common gynecological cancer in the United States, with a survival rate of about 80% when diagnosed early? Unfortunately, these numbers don't hold true when it comes to Black women. Whereas most women's 5-year survival rate is in the 80% to 85% range, for Black women, it's more like 60%. Please allow me to welcome Dr. Tashana Kayan Myers and Ms. Nefertari Moore for their much needed talk on endometrial cancer, with a focus on its medical, social, and emotional impacts. Thank you so much. Welcome, ladies. We look forward to hearing from you.
Good morning. Thank you for having us. I'm just going to begin by sharing my slide. All right, good morning. So we're going to be talking about endometrial cancer and hopefully just defining some of the facts. Our agenda is to define endometrial cancer. You've already heard some of the statistics as it applies to Black women, and we're going to continue to discuss that. I'm going to discuss signs and symptoms. I'm going to begin to talk about what's normal and abnormal, and then discuss why it's so hard for us to make the diagnosis in Black women. So this is just pelvic anatomy. So the uterus sits right in the center with the fallopian tubes and the ovaries off to each side. This is where your periods normally come from, with the bladder in the front and the bowels resting behind. Endometrial cancer statistics for 2021. So 66,000 women are going to have this diagnosis this year, and about 10% are going to be Black women. 13,000 women are unfortunately going to lose their lives to this disease, and surprisingly, 20% will be represented by Black women. So it is clear that while we are less likely to develop endometrial cancer, 1 in 37 versus 1 in 34, we are more likely to die of the disease if we do have it. So 1 in 100 versus 1 in 70 compared to white women. So what are the facts? It is the most common cancer that can happen in the uterus. It is the most common gynecologic cancer that I take care of. And it usually occurs around the time of menopause. But younger women are also at risk, and we need to be aware of this. The other thing we need to be aware of is that the Pap smear only screens for cervical cancer. It is not a screen for uterine cancer. And so you may be getting your checkups and getting your Pap smears and still be at risk. So who is at risk? So if you're overweight, if you've never been pregnant, if you've had late menopause, defined as older than age 52, if you have high blood pressure, diabetes, and it can run in families. So a family history of endometrial or colon cancer. If you've ever been diagnosed with a precancer of the uterus, sometimes called hyperplasia. If you've ever used estrogen alone, so without progesterone. If you've used tamoxifen, frequently used in the treatment of breast cancer, or if you've had radiation for another cancer, either rectal cancer or anal cancers. So who gets diagnosed? Average age is 61. So the majority of women are going to get diagnosed between 50 and 69 years of age. But 5% are going to be before the age of 40. These are young women. 20 to 25% will be premenopausal. The things we can do to protect ourselves: combination birth control pills, if you use them for a year consistently, can provide protection for up to 10 years. So what are the symptoms? Bleeding. It's so nonspecific, and yet it's normal for us to have bleeding during some times of our lives. But postmenopausal bleeding, bleeding after menopause, is really the hallmark. Dysfunctional bleeding. So if your period comes every 28 days and now you're bleeding every 2 weeks, that's abnormal. And for women who've stopped bleeding, and I think this is something I'd like to stretch, even a brown spot like old blood, even a single spot of bright red blood is abnormal after menopause and should lead to a prompt evaluation. So let's just define normal. What's a normal period? Normal is between 21 and 35 days. Most of us are going to land between 28 and 30 days. It can last from 2 days to 7 days. Bleeding can be painful or pain-free. It can be light or heavy. Now, heavy does have a definition as well. If you find that you're missing work because of bleeding, if you find that you're being transfused because of bleeding, that is not normal. And any bleeding really outside of this should be discussed and evaluated by your gynecologist. So what is menopause? It's 12 months without a period. It usually happens around age 52. It can happen earlier or later. But once bleeding has stopped, it should not return. I've heard women say, but I got really stressed. Stress doesn't bring your period back. You need to be seen. So if you stopped for a bleeding of 1 year, and it returns, see your gynecologist. We make the diagnosis by doing a biopsy. About 8 out of 10 women can have this done in the office. So it's putting a straw inside the lining of the uterus. But if you can't tolerate the discomfort, then you're taken for a D&C, a procedure operation in the operating room where you're made comfortable, and then the lining is scraped. We use ultrasounds to help us look at the lining to see if there are any masses or fluids to help us make that diagnosis. So why is it hard for Black women for us to make the diagnosis? Because of a benign condition called fibroids. So fibroids, 99% of the time, are not cancer, but they can distort the anatomy so much that your ultrasound is limited. It's difficult getting a biopsy. And so these non-cancerous things being more common in Black women really make a challenge for us to make the diagnosis. So what can you do? If you're having these symptoms, you need to have a biopsy. If it can't be done in the office, then it needs to be done in the operating room. What can we do to keep ourselves healthy? Well, in generally, manage our weight, exercise, manage our blood pressures, our sugars, know our family history, discuss the pros and cons of hormonal therapy. And then if the diagnosis is cancer, ask to be referred to a gynecologic oncologist. So my advice, woman to woman, you are your best advocate. Push for the ultrasound or the biopsy or the referral. You know your body best. You know when something doesn't feel right. And then educate yourself about what is normal. And just keep in mind, our girlfriends may not be our best resource. Thank you. I'm going to turn the floor over to Ms. Neftari Moore.
All right, thank you for having me here. And thank you, Tashana, for a great presentation. So now I'm gonna, tell my personal story with endometrial cancer. I was first diagnosed in 2013. In fact, it was in November of 2013. I had experienced some heavy bleeding with lower back pain for probably over a month. But one morning I woke up and I was so weak and in so much pain from the bleeding that I had to, visit an ER. I decided to go and visit the ER. So I went into the ER and I explained to the doctors who I saw there about, what I was going through with the bleeding, how long it was, and, just what I was experiencing. And I was told that, the bleeding was the result of maybe, my change in cycle, my menstrual cycle, or, it could be stress, the body reacts in, mysterious ways that can cause, stress and maybe some bleeding. Those things didn't sound right to me. And most importantly for me is that I know my body and I knew that this was not, normal or a change in my cycle because this had never happened before. And so I basically pushed back, and said, that I would like to be seen further, have further testing done to see what was going on with me, because they wanted to send me home with some ibuprofen for the lower back pain, and they wanted me to rest. But I knew that this wouldn't take care of my problem. I didn't know what was going on, but essentially they did get me in to see a tech, and she performed the transvaginal ultrasound. And afterwards, I guess they saw, that I really was bleeding from, the uterus, and they referred me to an outside specialist, who then had me. I went to see that specialist, and then afterwards, I had a DNC, and the DNC did reveal that I had endometrial cancer. And I thought, I was just devastated, when I found out the results. And I thought to myself, had I, listened to those doctors at the ER, and just went home and relaxed, and, I could have, I was diagnosed at an early stage, but I could have been, diagnosed at a later stage if I left it alone, or essentially died, without knowing what my diagnosis was. I went into treatment. I was put on a hormonal treatment of progestin, and it worked for about 9 months. But as follow-up care, I would continue to go in and see an oncologist, and they would do a biopsy. And so on my third biopsy, it was found that I had a recurrence of uterine endometrial cancer. So at that point, at the age of 35, I had a hysterectomy. And during the hysterectomy, they only removed my uterus, and they left me with both my fallopian tubes and ovaries. And so at the age of 38, I was diagnosed with ovarian cancer. Now, why am I talking about ovarian cancer? It's because it's a part of my journey. And when I had endometrial cancer, the oncologist that I saw, I asked, if I should have any sort of genetics testing. And I was told no, that, there was no relation to any, type of genetics that would be associated with the endometrial cancer I had. But when I found out about the ovarian cancer, I had a new oncologist, and she sent me to have genetics testing. Well, it turns out that I do have Lynch syndrome, and Lynch syndrome is linked to endometrial cancer. So I always thought to myself, and I still think maybe if had they taken out everything during the first time I had surgery for the hysterectomy, maybe I would have been diagnosed with ovarian cancer. Had she, this particular doctor did, further testing, that would have been found out. Had I been listened to, in the first place. But I would say today, I'm doing pretty well. I'm NED from both cancers, and I'm advocating on behalf of other women, and in particular Black women with endometrial cancer or gynecologic cancers in general, simply because, our voices at times are not being heard. And so that's why I'm here today, to be an advocate and to share my story, and hopefully it will help, someone else, or empower other women through their journey, or through other someone else that they may know, or family members that are going through the same thing. So once again, thank you for listening to my story. Thanks for having me here.
Thank you, Ms. Moore. Thank you for sharing your story and for highlighting the importance of Lynch syndrome. I think there are times when we think about genetic cancers not really affecting Black families, and we do. We have genetic tumors in our families, and family history isn't always clear. We don't always know what grandma had, and people didn't talk about it. So I'm grateful to be sharing the panel with you. I'm just looking to see if there are any questions in our Q&A.
Yeah.
So I'm gonna start. So one of the questions, I think it's what percentage of women with endometrial cancer require hysterectomy? I think it really depends on your age. So if you don't have children and you desire to retain the ability to carry a pregnancy, then we have hormonal options like Ms. Moore talked about, things we can do rather than do the hysterectomy. Ms. Moore, this question is for you. How long did it take to get your diagnosis after the DNC?
Well, it took about 3 days, I want to say. 3 days after having the DNC, I got a call from the GYN specialist with the results.
And then how long did all of it take? So from your first symptom to your diagnosis?
I would say roughly 2 weeks. They got me in because when I saw the specialist, he could see that I was really bleeding profusely and had a lot of clotting, and my blood levels were low because I became anemic due to the loss of so much blood. So they moved pretty quickly in getting me taken care of.
Another question is why is it that endometrial cancer is the most common GYN cancer, yet most women have never heard of it prior to diagnosis? And I think because many women are treated and cured with hysterectomy. And so they don't talk about it, right? They go in, they have the hysterectomy. Hysterectomy is very common. They end up doing very well. And so it just, there's a small percentage of women who are going to recur, small percentage of women, relatively speaking, compared to other cancers that are going to need additional therapy. And so I think conferences like this are extremely important to just raise awareness that it can happen at any point. You can be in your 20s, 30s, and get this diagnosis.
I see someone in the chat that didn't put their question in the Q&A.
Okay.
And it's asking, this person is asking, is there a website or an email to contact me by Do Advocate? So yeah, I am working at Share Cancer Support as an advocate, and with as well as an outreach program and the uterine cancer program that we started last year. And I will put the website in the chat and along with my phone number.
Awesome. So there's a question about Lynch syndrome. Do you want to take that one or do you want me to?
I don't see. Is it?
Oh, in the Q&A.
In the Q&A. Okay.
So Lynch syndrome is a genetic mutation. So it can be passed from between family members that is associated with endometrial cancer, predominantly colon cancer, and ovarian cancer. So women will present with endometrial or ovarian, men will present with colon cancers. But if you carry the gene, you have a 50% chance of passing it on to your children. And so once women have a diagnosis of colon or endometrial cancer, we now screen everybody for this diagnosis because we realize that it is more prevalent than we originally thought.
And I also want to say in terms of Lynch syndrome, because my oncologist now knows that I have the mutation, I'm being screened, surveilled pretty closely. I've had a colonoscopy, and I'll be having like colonoscopies and also mammograms quite often, essentially for the rest of my life. So they're watching me due to, the connection to colon cancer and, breast cancer and other types of cancer that Lynch syndrome can be associated with.
All right. So there's a question in the Q&A. Can you talk about why Black women are more prone to fibroids and how this factors into misdiagnosis? So we don't actually know why Black and Latino women are more prone to fibroids, but we know that this is true. So the fibroids are like, if you think about the lining of your uterus like a lawn, fibroids are like rocks. So they distort your ability to sort of navigate through. And so a lot of the things we use to get biopsies are soft, and they're obstructed by the firmness of the fibroids. It changes the shape of the canal. So what's normally a straight road becomes zigzaggy. It can even make accessing or seeing the cervix, so getting entry into the uterus, more challenging. So those are some of the anatomic reasons why fibroids present a challenge. So even when you're trying to look on ultrasound, people sometimes assume the fibroid is the cause for the bleeding, but it may not be. There may be other factors. Can a person get endometrial cancer even though they've had an ablation? So an ablation is essentially the burning of the lining of the uterus. Unfortunately, you can. So if your bleeding comes back after you've had an ablation and that lining was burnt and you stopped bleeding, then you're at risk and should try to get a biopsy done again or get an explanation for that bleeding. Do you see anything else?
Yes, I see someone's asking a question, with the hysterectomy, why do they remove the uterus and not the ovaries? In my case, I was told that they didn't remove the ovaries because they looked, they were in good condition, and also because of my age. At the time, I was 35, so they didn't want me to go into early onset of menopause and raise my risk of heart disease. So that was why, they didn't remove the ovaries at the time.
There's a question for you in the Q&A, Ms. Moore. So what were your symptoms of ovarian cancer?
What I'll say, I didn't really have any symptoms. How it was detected is because of my history of endometrial cancer. I was, being surveilled every 3 months at the time. And so the ovarian cancer was founded through a routine checkup, again, through an ultrasound, a transvaginal ultrasound. But I do know that some of the symptoms associated with ovarian cancer are, sometimes indigestion, also bloating, feeling full pretty quickly when you're eating. And also it can be associated with finding a mass or, some abnormal bleeding at times as well. So, and also it's pretty difficult at times because they say that some of those symptoms can be associated, just like with endometrial cancer, can be associated with other medical problems, conditions.
Yeah, we often call ovarian cancer the cancer that whispers, because the many of the symptoms you could have for other reasons, and that's what happens. Women attribute it to other things, and so the diagnosis gets made late. So we have another question in the Q&A. Is genetic testing standard of care for endometrial cancer? So what I would say is genetic testing of the tumor is standard of care for endometrial cancer. and it's looking for these mutations in the tumor. If that is suggestive of you having a genetic abnormality, we then would send you for a blood test. Do you have any more questions in the chat?
I see someone says, what are the reasons against HRT after endometrial cancer?
So I wouldn't say after endometrial cancer. I think you can manage your symptoms of menopause with hormonal therapy after endometrial cancer. However, in a woman who has her uterus without a diagnosis of endometrial cancer, the hormones need to be taken in combination. So you shouldn't take estrogen by itself because it can stimulate the lining of the uterus and place you at risk for the development of endometrial cancer.
And I think someone else asked, they're asking, they said they have two daughters in their 20s and 30s, and they're having heavy bleeding with clotting and anemia. Is it recommended that they get tested for Lynch syndrome by their GYN?
So my recommendation is that they get tested for why they're having this heavy bleeding. So they should potentially get endometrial biopsies, ultrasounds, a diagnosis. So bleeding and anemia are symptoms. What we need is a diagnosis for why they're having that. We only screen people who have cancer for Lynch syndrome or a strong family history.
And then is it reasonable to test for ovarian cancer after being tested or after being diagnosed with endometrial cancer? So I guess only if you haven't had your your uterus removed.
Agree.
Yeah.
Only if you still have ovaries. Okay, so when professionals know about this, why wouldn't they recommend further testing, or have we evolved that much from time at visit or knowledge from most providers? So I will say that in 2009, we were not screening everyone for Lynch syndrome. And so around 2014 is when it became standardized. So yes, I think we are constantly learning and changing things. And so sometimes if you were diagnosed a long time ago, staying on top of what's happening in your cancer and seeing if there's something that's new that maybe you would benefit from. But now it is standard to do that testing. Those are all the questions I have in the Q&A.
Yeah, and I'm still looking through the chat, and I think we're pretty good on the questions. I think we've answered them all. Just want to say,
Well, thank you so much for sharing your story, Ms. Moore, and for really being a testimony that, you have to question your doctors. You have to, so while we as physicians, sort of are the experts in medicine, you are the expert about yourself. And if something doesn't sound right, like every relationship, if it seems like you're not getting what you need, then you maybe need to move on and find someone who can hear you.
Absolutely. And I want to say, especially if you're a Black female and you're going into some of these institutions to see these doctors and you're explaining your symptoms of whatever's going on, if it doesn't feel right, get a second opinion. You have that, it is your right to do so. So I would say exercise that, and you have a right to all of any type of medical records and anything that they've performed on you. So, and also I want to say, lastly, you can contact me at, in more at sharecancersupport.org and at the phone number that I put in the chat. And thanks again. It was for doing this presentation with you, Dr. Myers, and all the best, everyone. Have a great afternoon and rest of the day.
Thank you.